electronic cigarettes as a tobacco product in the Stop Tobacco Access to Kids Enforcement Act. This bill will also include e-cigarettes in the California Cigarette and Tobacco Licensing Act, the Smoke-Free Act, and it will require child-resistant packaging for e-cigarettes. This bill is about preventing an entire new generation of nicotine addicts. In 2013, there were 600,000 high school students who used nicotine. Just last week, a study funded by the National Institutes of Health and published in the Journal of American Medicine found that students who used e-cigarettes were 4 times more likely to try traditional cigarettes. The vast majority of e-cigarettes users smoke both e-cigarettes and traditional cigarettes. Companies know that once someone is addicted to nicotine, there is a good chance they will also smoke traditional cigarettes. If companies have to call these products tobacco products, it makes it harder for them to convince youth that e-cigarettes are a harmless alternative. Studies have found that 10 chemicals found in Proposition 65 warning on chemicals that have been found to cause cancer, birth defects, or other reproductive harm. It is hard to take seriously the claim that e-cigarettes are not marketed for children with flavors like banana split, cotton candy, gummy bears, and Skittles. Nicotine, as we know, is highly addictive, and addiction to nicotine usually starts early in life. About 90% of people who smoke cigarettes start before the age 19, and about 3 of every 4 teenage smokers continue to adulthood. Adolescence is a crucial time for brain development. Research suggests that when nicotine addiction starts in adolescence, it's harder to kick as an adult. The crux of this bill is that we define e-cigarettes as what they are, a tobacco product. This is crucial in protecting young people from becoming addicted to nicotine because it's the most common sense way to keep e-cigarettes out of our children's hands. Children are impressionable. This is a very real danger that e-cigarettes will renormalize smoking behavior and make something that children have never seen before appear cool and that is engaging in smoking behavior in public places like restaurants and other public places. Despite what opponents claim, e-cigarettes are tobacco products. The nicotine in e-cigarettes is derived from the tobacco plant. Without tobacco, there would be no electronic nicotine delivery devices. The vast majority of these projects do indeed have nicotine. The reason they exist in the first place is to maintain nicotine addiction. For the few products that do not have nicotine, it makes sense to regulate them as tobacco products because it's impossible for code enforcement and law enforcement officials to tell which products contain nicotine and which do not. The use of e-cigarettes is still an act that stimulates smoking, and the best way for enforcement officials to deal with them is to treat them like a tobacco product. This bill is sponsored by the American Cancer Society, Cancer Action Network, American Heart Association, American Lung Association, California Narcotic Officers Association, and the California College and University Police Chief Association. I respectfully ask for your aye vote.
Thank you, Member Cooper. And you have some witnesses with you today?
Mr. Chair, members of the committee, my name is John Lovell, and I represent 2 of the co-sponsors of the bill, the California College and University Police Chiefs Association, the California Narcotic Officers Association. I'm also here on behalf of the California Police Chiefs Association, and I received word this morning that the California Association of Code Enforcement Officers has also come on in support of the bill. This bill is fundamentally about children. The growth of e-cigarettes among children has been nothing short of alarming. Mr. Cooper's bill will bring e-cigarettes under the rubric of the STAKE Act, which is a proven strategy for keeping tobacco products out of the hands of children. It will also define these products for what they are, tobacco products. We are very proud to co-sponsor this bill, and we commend Mr. Cooper for bringing this forward.
Thank you, Mr. Lovell.
Good afternoon, Mr. Chair and members. I'm Tim Gibbs with the American Cancer Society Cancer Action Network, and we're also proud co-sponsors of this bill because, as Assemblymember Cooper mentioned, this bill is about preventing an entire new generation of nicotine addicts. It's critical for this bill that we define e-cigarettes as a tobacco product. The nicotine in e-cigarettes is derived from the tobacco plant. Other than a weak age verification law, we have no other regulations on e-cigarettes in California. The tobacco companies have been relentless in preventing these products from being regulated. Now we're at the cusp of meaningful regulation of e-cigarettes in California. Unfortunately, opponents on this bill insist that any regulation take place under the faulty premise that e-cigarettes are not tobacco products. The tobacco companies have been waging a battle all across this country to drive a wedge between how we regulate e-cigarettes and how we regulate combustible tobacco products. For the most part, students know that tobacco is dangerous. The tobacco companies want to maintain the fiction that e-cigarettes are safe. It's an abhorrent business strategy when those companies depend on hooking millions of young people on nicotine through e-cigarettes to eventually sell more combustible cigarettes. The consensus is clear. E-cigarettes are tobacco products. Internationally, you have the World Health Organization who recommends that e-cigarettes be treated as a tobacco product. At the national level, you have the CDC and FDA who have recommended that e-cigarettes be treated as a tobacco product. At the state level, you have the California Department of Public Health report from the state health officer on the dangers of e-cigarettes that recommends that e-cigarettes be regulated as a tobacco product. On the local level, you have 178 cities and counties that regulate e-cigarettes as a tobacco product. More than 40% of this population, or 40% of our population in California, is covered by laws that essentially do the same thing as this bill. And we have our largest cities, like Los Angeles, San Diego, San Francisco, who all have what is essentially this bill protecting their citizens. So to protect children from becoming addicted to nicotine, to protect workers from inhaling secondhand e-cigarette aerosol, and to improve the health of all Californians, we ask for your aye vote.
Thank you. Seeing a quorum present, Madam Secretary, please call the roll.
Bonta?
Here.
Mainshine? Here. Baker? Here. Bonilla? Campos? Here. Eduardo Garcia? Levine? Here. Mays? Here. Santiago? Steinnorth? Here. Stone? Here. Thurmond? Wood? Here. Got it.
We have a quorum. Thank you. Additional witnesses in support, please state only your name, organization, or city and position on the measure.
Lydia Bourne, representing American Academy of Pediatric California Division, in support.
Teresa Stark with Kaiser Permanente in strong support.
Jasmine Gordon with the California Black Health Network in strong support.
Brianna Pittman with the California Dental Association in strong support.
Alicia Sanchez representing the California Medical Association in support.
Whitney Stanford on behalf of First Five California and the First Five Association in strong support. Thank you.
Deputy Attorney General Matt Campbell on behalf of Attorney General Kamala Harris in support.
Jerry Jeffy representing the California Chronic Care Coalition in support.
David Ford for the Association of Northern California Oncologists and the Medical Oncology Association of Southern California in support.
Kimberly Chen with the California Pan-Ethnic Health Network in strong support.
Betsy Armstrong with the County Health Executives Association in strong support.
Tim Madden representing the California chapter of the American College of Emergency Physicians and the California chapter of the American College of Cardiology in support.
Sawait Siem on behalf of Health Access California in support.
Chair and members, Sean South on behalf of the California Primary Care Association in support.
Lindsay Freitas, American Lung Association in California, proud co-sponsor and strong support.
Terry Brennan on behalf of Service Employees International Union, proud member of Saved Lives California Coalition, strong support.
Callie Hampton on behalf of the American Heart and American Stroke Association, proud co-sponsor.
Vanessa Hina on behalf of the California Society of Anesthesiologists in support.
Michael Radigan on behalf of the Board of Supervisors, Santa Clara County, in support.
Amber King with the Association of California Healthcare Districts in support.
Justin Garrett with the March of Dimes in support.
Dr. Donald Lyman with California Academy of Preventive Medicine in support.
Matt Reed on behalf of Breathe California and the Breathe California affiliates in support.
Brandon Roberts with the Health Officers Association of California in support.
Nicole Wertelman on behalf of the Alameda County Board of Supervisors in support.
Farrah McDade Ting on behalf of the California State Association of Counties in support.
Thank you. See no additional witnesses in support. I want to thank you for stating your position so clearly and efficiently. We'll now go to witnesses in opposition to testify. Please come forward to the table. As indicated earlier, there's 3 minutes each. Please proceed whenever you're ready.
Good afternoon, Chairman and members. My name is Carrie Hess, and I'm here today to ask you to oppose this bill in 3 capacities. First, as a former smoker of 21 years. Second, as co-owner of NorCal Vape in Reading. And third, as a registered addiction specialist with almost 10 years of experience who believes that vapor products are the best and most successful tool for harm reduction and nicotine management ever invented. Please note that I am not affiliated with Big Tobacco in any way, and I'm here in a voluntary capacity. The vapor industry supports common sense regulations to strengthen California's existing ban on sales to minors, as well as child-resistant packaging. However, we cannot support this bill because it falsely defines tobacco-free products as tobacco. So I have to ask, why is it so important to define vapor products as tobacco? You may have heard that it is because they contain nicotine, and that nicotine can only come from the tobacco plant. This is incorrect. In addition to the tobacco plant, nicotine is naturally found in many vegetables, including eggplants, potatoes, tomatoes, and more. You have also heard the argument that including e-cigarettes in the statutory definition of tobacco is necessary to protect the children. This is also incorrect. Every provision in this measure to protect children can be advanced using the current definition of e-cigarettes. Many vapor products do not contain nicotine at all. The sponsor of this bill has repeatedly claimed that e-cigarettes are not nicotine-free. This is simply untrue. Manufacturers in California have invested millions into equipment and procedures dedicated to manufacturing non-nicotine products, and moreover, those vapor products which do contain nicotine are clearly labeled as such. It does not make any sense to categorize a non-nicotine product as a tobacco product. The argument that we are marketing to minors is offensive and inaccurate. Vapor products are created by adults for adults. Several studies have shown that flavors are an integral part of the vaping experience as they help adults to break their taste to deadly tobacco. To reiterate, our sole overriding issue with this bill is that it defines vapor products as tobacco. We support the bill's provision related to minors, and in fact, all of the policy goals contained in this bill can be achieved by using the existing statutory definition for e-cigarettes. We cannot emphasize enough that we wholeheartedly share the goal of protection for minors, but we cannot support our product being lumped into the same statutory definition as combustible cigarettes. Mr. Chair, members, I would ask each of you to consider if you want your legacy to be the continued propagation and prolonging of the tobacco epidemic. If the author of this bill were proposing appropriate regulations specifically for vapor products, we might support it. However, the legislation being proposed today unfortunately persists in using inaccurate and illogical definition for e-cigarettes as tobacco products, and for this reason, we must strongly oppose this measure.
Thank you. Next witness.
Good afternoon, Chair and distinguished members of the committee. My name is Gregory Conley, and I am here today on behalf of a nonprofit called the American Vaping Association, which advocates for responsible and science-based policy towards vapor products, otherwise known as electronic cigarettes. Earlier this month, I proudly celebrated 5 years as a non-smoker thanks to vapor products. August 2010 was my quit date, and I am here today to urge you to oppose this bill. Not just because it falsely redefines a tobacco product to include often nicotine-free products and tobacco-free products, but also because you are falsely redefining California's definition of smoking to include the use of a smoke-free product. As my colleague has noted, the vapor industry is not opposed to common sense, reasonable regulation. We would love to see sting operations happening today in vape shops across California to ensure that sales are not being made to minors. However, this bill goes about it in a completely backwards and illogical way. The idea that we must define these tobacco-free, smoke-free, and often nicotine-free products as tobacco simply does not make sense. Do youth study our statutes? Do youth see whether or not the California legislature has decided that something is tobacco? What evidence do they have that this classification would actually reduce usage in any way different than if we simply created the Stop Vapor Product Sales to Youth Act? It would not have as friendly of an acronym as STAKE, but it would be an effective bill that would protect youth. As somebody who considers himself to be not only a public health advocate, but also an anti-smoking advocate, it has continually surprised me over the past 5-6 years that so-called anti-smoking groups that dedicated supposedly their lives to ending the smoking epidemic, have been the loudest, most vociferous voices against these smoke-free products, especially now in the light of last week's release by Public Health England, a very respected watchdog, a report finding these smoke-free, tobacco-free products to be at least 95% less hazardous than smoking, that they pose no known risk to bystanders, and that there's no evidence of a gateway effect. The study referenced earlier does not actually show any sort of gateway effect. It is like saying that teens who experiment with red wine versus teens who never experiment with red wine. Which of those teens do you expect will go on to drink vodka in the future? Which of them will be more likely? That is what they were saying with this study. They found that teens had experimented with vapor products. 1 year later, the teens who had experimented with vapor products more likely to have reported smoking just one cigarette. So there's no gateway effect being shown. Smoking, over the past 3-4 years, a record dramatic decline of 40%. Never before seen. So this idea that this is creating a new generation of smokers and this is leading to smoking is simply false.
You're at
Thank
time.
you very much.
Thank you very much. Additional witnesses in opposition.
My name is Mario Weeks. I represent the Vapor Spot, and we vehemently oppose this bill.
My name is Randy Phillips. I'm president of R&D Creations eLiquids, and I oppose this bill.
My name is Kathleen O'Connor, Lake of Vape from Lakeport, California, and I am strongly opposed to this bill.
My name is Josh Jones from Oakland, California. I've been a non-smoker for 1 year, and I oppose this bill.
Okay, wait a second. Name, organization, and city, and position.
My name is Eddie Walsh, owner of Dr. Picnic's Magic Elixir, non-combustible, non-tobacco product.
Next, please, stick to the rules.
Danielle Bloss, on behalf of Apollo Electronic Cigarettes and NotBlowingSmoke.org, strongly oppose.
Thank you.
Elmer Torres, on behalf of Vapory City, and I strongly oppose this bill.
Stefan Dieduck, co-president of the Northern California chapter of the Smoke-Free Alternatives Trade Association, in strong opposition.
Anna from Vapory City, and we strongly oppose this bill.
Michael Burnett, on behalf of the Vapor Spot, Sacramento, strongly oppose.
Jim Audi with Dripstick Vape, and strongly oppose.
Jacob Peltak with the Coachella Valley Vapors, and I strongly oppose.
Michael Duncan, on behalf of Dripstick Vape, I strongly oppose.
Wesley Brown, co-founder of Abyss Vapor Solutions and Abyss Vapor Lounge, in strong opposition.
Eamon Wilson from Little Rock, California, in strong opposition.
Zach Darrow, Livermore, California, strongly oppose.
Abdel Abu Abdo of Beetlejuice Vapors, I oppose this bill.
Connor Moore from Livermore, California, I strongly oppose.
My name is Jody Sweet, and I'm the owner of Cloudy Concepts eLiquids from Riverside, California, and I oppose this bill.
Nishant Kumar, biomedical engineer, I strongly oppose.
Christopher Blake, Los Angeles, California. Mystic Gypsy eLiquid, I strongly oppose.
Ryan Dye, Livermore, California, and I strongly oppose.
Phil Brownthal from Native Wicks, and I strongly oppose.
Jeff Braithwaite, owner of Tasty Vapor in Oakland, also NorCal chapter Safada co-president, and I oppose.
Cyrus Flight from Antioch, California, strongly oppose.
Jonathan Davenport from San Dimas, California. On behalf of Enjoy, we oppose this bill.
Isaiah Maldonado, representing E6 City Riverside, strongly oppose.
Jeff Hess, co-owner of NorCal Vape in Redding, California, and I strongly oppose this bill.
Charles Mondor, E6 City 4 Riverside, and I strongly oppose.
Aaron Peterson, Space Jam eLiquid in Newport Beach, California, and we strongly oppose.
Austin Smith, E6 City 4 Riverside, I strongly oppose.
Mark Burton, co-president, Southern California Safada, partner at California Capital Partners, Marina Del Rey, strongly oppose.
John Adrian, Sacramento, California, strongly oppose.
Doug Hughes, co-president, SoCal Safada, managing director, Boilermaker Vapor, strongly oppose.
J.O. Koo from Irvine, California, representing Five Ponds Incorporated. I urge you to oppose this bill.
Camille Winans from Buckshot Vapors, Inc., strongly opposed.
Vince Satilli from Alloy Blends, strongly oppose this bill.
Jacob Johnson from Buckshot Vapors Inc. in Costa Mesa, California. Strongly oppose.
My name is Lucy Noble. I work at Alloy Blends, Steam Wholesale, and work alongside a lot of our advocacy groups. I strongly oppose this bill. I'm from Orange County, California.
Evan Kimbrough on behalf of Propaganda E-Liquid. I strongly oppose this bill.
Eric Hutchinson, Avid Life Incorporated. Strongly oppose this bill. Thank you.
Jeff Nelson on behalf of Cosmic Fog Vapors. We strongly oppose this bill.
Nicholas Danuccio on behalf of Propaganda E-Liquid, and I strongly oppose this bill.
Michael Henderson, owner of Cryptic Creations E-Liquid, Orange County, strongly oppose.
Kyle Hashimoto on behalf of Native Wicks. We strongly oppose this bill.
Gary Johnson, it is Vapor 7. I strongly oppose this bill.
Eric Lund, it is Vapor 7, San Jose, Paratus Mod, San Jose. We strongly oppose.
Joshua French, owner of Visalia Vapes. I oppose this bill.
Edward Wolf, John Oliver's Jeff Lung Society, oppose this bill.
Melanie Cuevas, on behalf of Enjoy Corporation, opposed on the basis of e-cigarettes being defined as.
Christopher Tucker, on behalf of Cutwood E-Liquids and Vaping Industries out of Irvine, California, we oppose this bill.
Oscar Covarrubias, Fresno, California. I strongly oppose.
Jonathan Thomas with Flawless Manufacturing and Distribution, strongly oppose this bill.
Chris Battenschlag, owner of Cyber Liquids, strongly oppose this bill.
Amanda Mumper from San Diego, California with Vape Capital, and I oppose this bill.
Anthony Garcia, co-founder of Cyber Liquids from Buena Park. We strongly oppose this bill.
Daniel Salazar, Fresno, California, owner of Cyber Liquids, strongly oppose this bill.
Frank Compston, co-owner of Blue Sky Vapes, strongly oppose.
Mark Rodriguez, Fresno, California, Cyber E-Liquids, strongly oppose.
Christina Compton, co-owner Blue Sky Vapes, strongly oppose.
Ryan Zrinsky, Cyber Liquids, California, strongly oppose.
My name is Kirsten Sherhold. I'm from Burbank, California, representing Vape Verde, and we strongly oppose this bill.
My name is Brian Macias, employee of Cyber Liquids, and I strongly oppose this bill.
Hima Misbahi, CEO of Peppermint Clouds. I strongly oppose.
Tom Riddell of No Buts About It, Cotati, California, and I strongly oppose this bill. Thank you.
Nicholas Gao, CFO, Peppermint Clouds, strongly oppose.
Christy Smith, No Buts About It, strongly oppose this bill.
Landon Long from Cloud Drops and Vapor Pins LLC. I oppose.
Bobby Williams, small business owner of Vapor 93 in Rockland. I strongly oppose.
Ryan Bolter, Costa Mesa, California. Strongly oppose.
Matthew Villarreal from Los Angeles, California. Smoke free for 3 years. Strongly oppose.
Ron Webb, Majestic E-Juice, Costa Mesa, California. I strongly oppose.
Kyle Rhines of San Jose, California, and I strongly oppose.
Josh Hart, Folsom, California. Strongly oppose.
Natalie Gomez, former Miss Santa Clara County, and I strongly oppose.
Haney Tanous, co-owner of Millbrae, Belmont, and Redwood Vape, very strongly oppose.
Ryan Wilson, owner of Vapor Connoisseur, Ventura, California, taxpayer, employer, and it's smoke-free for 3 years now. Strongly
Coco Jekelian, co-owner of Redwood, Millbrae, and I strongly oppose this bill.
Jason Lau, Ventura, California, strongly oppose.
Austin Turnell, I'm employed in the industry. I strongly oppose.
Scott Taylor, on behalf of the Vapor Spot, I strongly oppose.
Robin Tapia, co-owner of Vape Crave, I strongly oppose this bill.
Eric Trotter, owner of the Force Vapors LLC, Los Angeles, California, I strongly oppose.
Orlando Underwood, owner of Vape Crave Marietta, strongly oppose.
Itai Suez from Santa Cruz, California. I'm a small business owner, taxpayer, voter, and I strongly oppose this bill and all the misinformation that's.
Dakota Cartagena, smoke-free for 1 year. I represent East City, Palm Desert. I strongly oppose.
James Heaton, owner of Vaping American-Made Products, smoke-free for 2 years, strongly oppose.
Evan Sutsumita, Vaping Industries, Costa Mesa, strongly oppose.
David Van Buren, owner of Big City Vapor in Anderson, California, and I strongly oppose.
Steve Kennedy, owner of Kennedy Enterprises, Anaheim, California, registered voter, strongly oppose.
I'm Johnny Nelson. I'm from Sonora. I'm a voter, and I strongly oppose this bill.
My name is Nick Kennedy, Kennedy Enterprises, and I strongly oppose.
My name is Brandon Blind. I'm a voter in this state, and I strongly oppose this bill.
My name is Kelpie Taylor. I'm a future business owner and a smoke-free vapor of 3 years.
I'm Tommy Colburn. I'm a registered voter in California, and I strongly oppose this bill.
My name is Angel Gomez, owner of the Vape Shop LLC in Fresno, California, and I strongly oppose this bill.
Cyrus Malikzadeh, Apollo e-cigarettes, voter. I strongly oppose.
My name is Joseph Mejia. I am a registered voter, and I am employed by the vape industry. I'm against this bill.
Rich Kellett, small business owner. I oppose this bill.
Rodney Johnson, owner of Beach City Vapors, Long Beach, California. I strongly oppose.
Lisa Kellett, I own Villain Vapors, and I strongly oppose this bill.
My name is William Zadra with Beach Vapes. I strongly oppose.
Ash Lima, I strongly oppose this bill.
My name is Chantel Garces. I'm representing Coastal Fog E-Liquid, and I strongly oppose this bill.
I'm Roy Santos from Dime Bar, California, Vape Life, and I strongly oppose this bill.
My name is MacArthur Chu. I own Central Call Vapors out of Daly City, California. I oppose this bill.
Justine Manervey, Vape Life, I oppose this bill.
Jason Rommel, Grand Vapor Station, and Vape Mill, I fully oppose.
Atul Gandotra on behalf of HRK Industries, and we strongly oppose.
CJ Lotspike from Monterey, California, oppose.
Gary Riddle, owner of Mr. Good Vape, strongly oppose.
Legend Lotspike, Seaside, California, strongly opposed.
Casey Zoltan, TSL Flavors, West Los Angeles, strongly opposed.
Kelly Koopman, on behalf of the Electric Cigarette Lounge in Sacramento, and I strongly oppose, and I've been smoke-free.
Vaping Munson, I strongly oppose.
Kevin Lee, owner of Leland Shop, Concord, California, I strongly oppose.
Robert Jones, owner of Smokeless Smoking, strongly oppose.
Jordan Seum from Concord, California, strongly oppose.
Katie Dunn from Smokeless Smoking, and I strongly oppose.
Cheryl Bautista, owner of the Vapors VPRS from Tracy and Merced, I strongly oppose.
Matt Zoffman, Orangeville, California, I strongly oppose.
Alec Bellarmino, the Vapors Tracy, and the Vapors Merced, strongly oppose.
Saveto Duran, Concord, California, strongly opposed.
Bryce Romano, co-owner of Culto Vapors here in Sacramento, strongly oppose.
Desi DeMalo, Vapors Tracy, Vapors Merced, strongly oppose.
Arnold Lagarda, co-owner of Culto Vapors in Sacramento, strongly oppose.
Rudy Peralta, the Vapors Merced and the Vapors Tracy, we strongly oppose.
Jesse James, Merced, California, Merced Vapors, Tracy Vapors, and Imperial Vapors, strongly oppose.
Damian Phillips, owner of Imperial Vapor, and I strongly oppose.
Eric Cook, owner of Lost Coast Liquid out of Folsom, and I strongly oppose.
Brendan Kavanaugh, co-founder of Elixir Vape Co. We make herbal vape products. Strongly oppose.
Karen Avila, Santa Ana, California, Cali Formula Mixers, strongly oppose.
Ben Cabby, Pacifica, California, representing Vape Mill Technology Application, and I strongly oppose.
Mike Nunez, Hemet, California, strongly opposed.
James Lee, Norco, California, strongly oppose.
Alex Rodriguez, Los Angeles, California, strongly oppose.
Joshua Albert, San Gabriel, JA Design and Fabrication, I strongly oppose.
Angela Begalba from United Vapors, and I strongly oppose.
Joey Ko, co-owner of Caught the Vapors Burbank, Nice Juice Co., and co-founder of United Vapors, strongly oppose.
Jason Fritz on behalf of Jay's Vapor in Temecula, California, and I strongly oppose.
Jeremy Tosi, San Francisco, owner of Cloudmaker Technologies, strongly oppose.
Daniel Jackson, Temecula, California, strongly oppose.
Kale Crace, on behalf of Vape Safe USA, we strongly oppose.
Kathy Holtz, Sacramento, California, former smoker of 20 years, quit.
David Lel Hansen from Phelan, California. I was a credentialed school teacher since 2000.
Strongly opposed.
Mitchell Nguyen, Vapor Fair and Uncharted E-Liquids, strongly opposed.
Joshua Crane, Craft Vapory, strongly opposed.
Stephanie White, Orange, California, on behalf of Elysian Elixirs, strongly oppose.
Lonnie Bozeman, Torrance, California, Saber Vape, strongly opposed.
Nolan from Elysian Elixirs from Orange, strongly opposed.
John Harrington, Craven Vapor, Santa Clara, California, strongly opposed.
Brady Bates, Beard Vape Co., strongly opposed.
Sargon Toma. It is Vapor 7 out of San Jose, California, and I strongly oppose.
Nikki Moreno, representative of Desert Vapors, and we strongly oppose.
James Lewis, founder and CEO of Gonzo Vapors out of Garden Grove, California, strongly opposed.
Brendan Ibarra on behalf of Desert Vapors in Palm Desert, California, and I oppose this bill.
Samuel Villanes from 29 Palms, California, Vaping Oasis, I strongly oppose.
Henry Ho from Stockton, California, owner of VaporWorks and Vape Troopers e-liquid, strongly oppose.
Calvin Robinson, 29 Palms, Vaping Oasis, I strongly oppose.
Ryan Flores, owner of Hella Good Vapors from San Jose, California, strongly oppose.
Edward Bongbonga, co-owner of the Vape Bar San Jose, California, I oppose.
Warren Hensel III, representing Los Angeles Vapors, strongly oppose.
Nate Salfin, Menlo Park, California, the Vape Bar, strongly oppose.
Brent Converse, Liquid Effects, strongly oppose.
Dwayne Morrison, co-owner Liquid Effects, Orange County, strongly oppose.
Reina Garcia, Cali Steam e-liquid, strongly oppose.
Frankie Dahl Ollinger, owner of Vape It Up HB 1 and 2, strongly oppose.
Russ Smelser, owner of Desert Vapors, strongly oppose.
Michael Mortensen, representing the Mod Doctor in Coachella, California, 2 years smoke-free. Daniel Ryan, registered voter, Canyon Lake, California, strongly opposed.
Chris Dobson from Menifee, California, opposed.
Robin Pennock of Elevate LLC in Vallejo, California, strongly opposed.
Ace Sumalong, management of the Vapor Spot here on 27th and J, strong opposed.
Greg Nielsen, spokesman for Fantastic 5, Monrovia, California, strongly opposed.
Leo Blalians, owner of Burn Nerd Smoke Shop, I strongly oppose.
Cajun Jackson, Roseville, California, strongly opposed.
Conrad Kazmar from the Vapor Spot, strongly opposed.
Sam Dunson, Oak Hills, California, co-owner Kelly Powder Box Mod, strongly opposed.
Robert Serra, Folsom Vapor, strongly opposed.
Richard Avila, owner Chunky Juice Premium E-Liquid, also SFATA member, I strongly oppose.
John Alvarez, owner of JLA Vapors, and I strongly oppose.
Alyssa Simpson, Adelanto, California, I strongly oppose.
William Merriam, City of Apple Valley, and I strongly oppose.
Troy Scribner, owner of Vaping Up, and we strongly oppose.
Randy Freer, poet Electronic Nectars, we strongly oppose.
Manuel Rivera, Visalia, California, I strongly oppose.
My name is Derek Bailey. I'm a manager at Visalia Vapes in Visalia, California, and we strongly oppose.
William Avila, TSL Flavors, strongly oppose.
Tanner Pendergraft, Visalia, California, strongly oppose. James Chong, owner of Vinyl by SJ, I strongly oppose.
Ryan Atai, owner of Fresno City Vapor in Fresno, California, and we strongly oppose.
CJ Cachelar, co-founder of ECC and VPX, strongly opposed.
Pedro Cardona, owner of Redwood E-Juice, strongly opposed.
Derek Awohi, representing Fresno City Vapor, and we strongly oppose.
Jonathan Halili on behalf of Vapor Evolution in Cerritos in Los Angeles, California, and I strongly oppose.
Rudolph DeBoard, Trace Gringos Vape, strongly oppose.
David Augustine, Leandro, California, owner of Totally Vaped Out and Sweet Tooth E-Juice, we strongly oppose.
Kaylee Loftus was Totally Vaped Out, strongly oppose.
Lorenza Bassa with Totally Vaped Out, strongly oppose.
Adam Zolli, representing NorCal Vape, and I strongly oppose.
Luis Cortez, San Jose, California, I oppose.
Jacqueline Voisin, NorCal Vape Reading, I strongly oppose.
Jasmine from El Grove, California, strongly opposed.
Joshua Jansen, NorCal Vape, Reading, California, I strongly oppose.
Brennan Hassman with Vape Fiends and Geography E-Liquid, strongly oppose.
Matthew Barrow on behalf of Vapor Spot, and we strongly oppose.
Joshua Kirby with Flavetastic Vapors, strongly opposed.
Anna Woolfolk from Vaporway HB, strongly opposed.
Andres Adeno from Vaporway HB, I highly opposed.
Dajan DeReich, small business owner, Los Gatos, California, strongly opposed.
Armando Serafin from San Jose, California, representing Vapors Against Underage Vaping.
Cosmin Hames with Vape Fiends Distribution and Geography E-Juice, and I strongly oppose.
Alex Contreras, co-owner of Rip Tip Technologies, LLC, and I strongly oppose.
Alden McDonald from Napa, California, representing Holy Grail, Elixir, and Broken Bottle, we strongly oppose.
Christina Friesen, Victorville, California, and I strongly oppose.
John Kavanagh from Vaping Industries, Costa Mesa, strongly opposed.
Alan Seiden, owner of Vape Fiends Distribution, Geography E-Juice, and Vape Till LLC, I strongly oppose.
Chris Coppa, Vaping Industries, strongly oppose.
Melvin Tumaneng, owner of Stop and Vape Martinez, and I strongly oppose.
Ben Santos with Subhome Innovations and Lux Liquid Vapor, strongly oppose.
Wendell Ingram from Palm Desert, and I strongly oppose.
Jesse Hanks from Vacaville, California, strongly oppose.
Corey Andrews from Sacramento, California. I strongly oppose.
Renee Goudreau on behalf of Emporium Liquid. I strongly oppose.
Andy Vo with Vape and Peace, Vacaville, California. I strongly oppose.
Paul Goudreau, E-Cig Emporium, strongly oppose.
Joey Samara on behalf of Vapor One in Walnut Creek, in strong opposition.
Jacob Reyes on behalf of Desert Vapors, and I strongly oppose.
John Gideon, representing Desert Vapors from Palm Desert, California. I strongly oppose.
Jeremy Beard, representing Desert Vapors, strongly oppose.
Matthew Wan from Palm Desert, California. I vote not to pass this bill.
Justin Kaufman from Indio, California, on behalf of Desert Vapors, I strongly oppose this bill.
Andrew Ruppelt from Palm Springs, California, and I strongly oppose.
Thank you. Seeing no other witnesses in opposition, we can entertain any questions or comments from members of the committee. Assemblymember Baker.
Yes, please. Thank you, Mr. Chairman. Mr. Cooper, can you please address the question regarding the definition of tobacco and just address one of the main points that was raised? I could benefit from that.
I think it's very interesting that our speaker over here spoke about vegetable or plant products being used. I've never heard of that. And while some of those vegetables may contain nicotine, nicotine primarily comes from tobacco. That is what is used. And it's funny that 95 cities and counties in California already have some type of e-cigarette regulation. And many of the counties and cities these folks live in and come from already regulate it. So it is a tobacco product. Nicotine is the addictive portion of it. Bottom line, no ifs, ands, or buts about it. I spent 30 years as a police officer and 10 years working narcotics. Nicotine is addictive. That's why those laws were passed with tobacco. Sure, it's been extracted from a tobacco plant, but it's still highly addictive with it. And it's just disingenuous when these folks say that it isn't. And one thing I do support is cessation. It's a great job. Instead of smoking cigarettes, it's much better. But the fact is, it still contains nicotine. And that's the bottom line.
Just a little bit follow-up.
Please.
And you mentioned the counties throughout California that already do this. Does your bill in any way affect the ability of local jurisdictions to choose their own path in this regard? Let's say if they want to have something more strict or...
It would allow for that.
Okay. And the final one is, what are other states doing in this regard? You've probably had an opportunity to sample that. Can you...
There are quite a few states that have regulated. It's just really all over the board. And right now it's the Wild West. The FDA does not regulate it. Some folks spoke about some of these cigarettes that supposedly don't contain nicotine. Well, the FDA has done some tests and actually found nicotine in some of those devices. So really it's unregulated. Everything we eat and drink is regulated by the FDA. There's some law addressing that. With this, there is no law. So it's up to that individual manufacturer. And while most of them, I'm sure, are good businessmen, you have some that aren't.
I guess what I was getting more to is, have you seen, and there may not be any studies on this, if a similar statute has had the effect of helping or hurting cessation?
Well, the bottom line, I guess it comes down to, if this passes today, this bill goes through and passes, what does it do? These folks can still buy their vape cigarettes. Nothing changes. This puts it in legislation where it defines it as a tobacco product. So in my mind, it doesn't really change anything. They can still buy it. They can still sell it. So
maybe there isn't. It may be that there's no study out there that has looked at what the experience, the effect that these laws have had on the use of smoke tobacco. That's really what I was curious about. If in preparing this bill, if you've looked at that, and I'll tell you, I'm leaning towards supporting your bill. So okay. I'm not trying to set you down a path.
No, I didn't think that.
It's more along the lines. But I am curious if you've seen from other states that may have had any regulation of e-cigarettes similar to what you're proposing, if it has had an effect, positive or negative, on cessation.
That's right. Tim.
Sure. There have been other states that have passed legislation that's fairly similar to this. You know, we know in California, with 178 cities and counties that have passed e-cigarette regulations that do treat e-cigarettes like a tobacco product, it has had an effect in terms of the sort of renormalization of smoking behavior. You know, having children watch grown-ups smoke, use e-cigarettes in restaurants, in public places where people gather, has a detrimental effect. To your specific question on whether or not there are studies that have shown an ordinance or a state law that treats e-cigarettes specifically as a tobacco product, I can only tell you what we know in California, and that those cities and counties that have passed this, we are seeing the sort of explosion of e-cigarette usage, all over the state, and it's definitely time to act in California, and those cities have certainly seen the explosion is tempered, shall we say.
Any other questions or comments from members? Dr. Wood.
Yeah, this is my question. A couple questions for the people opposing the bill there. I believe it was you, sir, that said that there really hadn't been a dramatic increase in the use of these products by young people.
There absolutely has been an increase in experimentation of vapor products among young people.
But you said it was they'd try like one cigarette and then they'd be done.
What I was saying was that there were 2 points I made regarding youth smoking, which was there's been a rapid, dramatic, record decline of 40% in teen smoking in 2 federal surveys between 2011 and 2014, and also that the study that was brought up that was published in JAMA last week that is being used to say there is a gateway effect from vapor products to traditional cigarettes. The authors of that study have come out and said that that's not a proper conclusion to draw, because all they did was see, okay, of course, somebody who's willing to try a vapor product is the kind of person that's going to be willing to try a cigarette, and they'll be more willing to try a cigarette than somebody who won't even try a vapor product.
A couple other follow-up questions through the chair. You said there are lots of other chemicals in these vapors. There are, and I think it would be hard to deny that. When someone exhales this, you see this vapor. There are other chemicals. I'm not aware of studies that have been done to say whether they're harmful or not. But I believe one of you said the vapor is essentially harmless. But then you, I believe, said that it's 95% less hazardous, which implies that there still is a hazard. Correct?
That was the 2 authors of the Public Health England report essentially giving a worst-case scenario for the future. And that is worst-case scenario for the user. And what we do know is that inhalable medications, like the Nicorette inhaler that's made by Pfizer or GSK, there are international standards for what levels of different chemicals are allowed to be present in the vapor, in the mist that comes off of inhalable medicines. And the levels for the actual user, even assuming that the user is taking 600 puffs a day, which no one in this room actually does, the levels are below, for the user, what is allowed to be contained in an inhalable medicine. So then you're talking about bystanders, where it is a minute amount that the user is actually exposed to versus the bystander. So absolutely, there are chemicals, but there are chemicals in everything. I was in Starbucks this morning. California, perhaps more than any other state, has done more to miseducate its citizens through Proposition 65, because in Starbucks they were warning me about carcinogens. In the car rental place they were warning me about carcinogens. No one in this state, as far as I know, actually pays attention to those signs anymore, because they recognize, yeah, everything has chemicals. It's the levels that matter, not the mere presence.
And one final question. Thank you for your interesting. Sounded like rain. I believe I understood that one of your primary, and it could be coming from both of you, your primary objection to this bill is that this defines e-cigarettes as tobacco products. Is that fair to say?
Yes, correct.
So I come from a city where when I was the mayor last year, we actually passed legislation in the city of Healdsburg that did not define e-cigarettes as tobacco products, but we defined them. What we did was we by statute, by legislation, created a situation where they were treated like tobacco products, exactly through the same mechanism that we do for other things. So I'm curious, would you object to that? Because if your assertion is that it's the definition that bothers you, I wonder, I'd love to hear what you have to say about that.
Of course, if this bill was amended to make vapor products, non-tobacco products, to put them in their own category, it would be better. But there is a vast difference between the kinds of regulations that local governments enact.
So I guess
on
the answer
tobacco.
is no.
The answer is the bill would be a heck of a lot better, but we'd still like to work out some kinks.
Okay, thank you.
Thank you.
Additional questions or comments from members?
Mr. Chair.
Yes, Mr. Garcia.
I know that it's been alluded several times, this public health study done by the United Kingdom, and from what I've read in the executive summary, I'd be lying to you if I said I've read the entire study. It does two things, I think. It says, one, that the use of vaping e-cigarettes are less harmful than your traditional cigarette. And then it also, in my opinion, does not highlight a couple of things that I think are extremely important, and that's the data that would say here are the long-term impacts of vaping or utilizing these devices. And to me, where I get stuck here is where it does not give it a clean bill of health, saying that it is not harmless. What I think of when I get to that point is that it is said that 500,000 people, I'm going to estimate, give or take, die from smoking cigarettes in the United States. So the number of 95% less harmful, if I'm looking at it from the standpoint of people's public health and fatality rates, that would mean that only 26,000 people would die by using this type of device. According to the study that the United Kingdom has put forward, that it is 95% less harmful. So I get caught there where we have a situation where we take a zero risk position, or we lower the level, the threshold, if I may, for lack of term, in terms of the harm that it could cause if consumed. And so that's one. Can you kind of address some of those comments or points?
The vast majority of users of these products are either smokers, people inhaling burning smoke into their lungs on a daily basis, or they are ex-smokers who have switched. And I believe that if you had the two distinguished authors here before you today, they would not say that 25,000 people of the 500,000 per year, that they would actually die from vapor product usage. They are using that as the worst case scenario, the best number that would be easily understood by the general public. The general public tends to think in zeros and fives. If they say 97, 98, it's a little more confusing than just saying 95. I think that that would translate into, there have been studies on other products, a month off of someone's life versus, if you average a huge pool of people that have used the product, a month off their life perhaps, versus smoking where you have 6-7 years of 1/3 of the people who smoke plus many more.
So, the United Kingdom, which I think, and please correct me if I'm wrong, is a member of the European Union. I may be off there.
Correct.
In the European Union, many of the countries there have adopted far more stricter regulations.
And that has, I'm sorry.
And labeling as it relates to what these products contain, the limited amount of actual nicotine in these products, and of course the type of marketing that is done. My assumption is that you're probably not in favor of those types of regulations.
We would be perfectly happy to have the FDA step down with reasonable regulations on labeling, on good manufacturing practices, et cetera. We are gravely concerned about individual states doing this, because then you end up with 50 different regulations on labeling, 50 different regulations on what can be in the liquid, and that's disastrous for small businesses, especially those here today that don't have the resources of a large tobacco company behind them. And I'll add that in those European countries that have taken stiff positions, in the Asian countries that have pretty much banned, at the advice of groups like those supporting these bills, smoking is not declining in the way that it is declining in countries like the UK, where you have stop smoking clinics actually offering support to e-cigarette users. I can't imagine in the United States actually seeing Cancer, Heart, or Lung say one positive thing about vapor products, let alone have their stop smoking services actually lend support to people looking to quit smoking.
Thank you. I wanted just to just comment that I've had the opportunity to speak to a number of local business owners who are concerned about the added cost to the business. And one of the conversations that I had was, I'm not sure what type of price tag you put on public health and the lives of individuals. Assemblymember Cooper alluded to the industry. By no means, I believe the intention of this bill is to eradicate the business aspect of e-cigarettes and vaping. People will still have the ability to purchase these, just simply under a different criteria and umbrella in order for the purposes of regulation. And so, I've not heard anyone. A lot of the comments and conversations have been, I won't be able to stay in business because of this policy in shifting it over under the tobacco legal codes. Can you kind of...
I think the point of this bill is that it continues the campaign that the California Department of Public Health started back in January, where they started running commercials misleading smokers and misleading adults into believing that vaping may be as hazardous as smoking. That is the goal of these groups, is to make adults believe that the jury is still out on whether vaping is any different from any other tobacco product. I think that's morally wrong. I think it's scientifically wrong. And that is their goal. That has been their goal since 2009, when they tried to get the FDA to ban these things to adults.
But that would be in line with the public health report from the United Kingdom, right? That the jury is still out in terms of the public health implications, right?
My apologies for interrupting. No. The jury is still out on exactly whether it's 95%, 97, 98, 94%. There is no doubt, and even some of the most virulently anti-vaping researchers at the University of California, San Francisco, even freely admit, if you prod them a little bit, that yes, obviously, using a vapor product is far less hazardous than smoking.
Let me just close by saying that I certainly support those individuals who are here and who have, shared in the past and in the more recent conversations that this has changed their life, that this has improved their health, that their marriages have improved, and that they've become better role models for their children. But it doesn't change my outlook from the standpoint that there is still some harmful contaminant in these products that is really at the core of the conversation today. So I just wanted to close with those comments. Thank you.
Other comments or questions from members? Assemblymember Thurmond.
Thank you, Mr. Chair. I want to thank the author for bringing this bill. I want to thank those who've testified in support and against, and for all those who've come here to speak, because this is not an issue that is clear, very, very much so. I'm no expert on it. I got a lot of questions, and I appreciated hearing all the perspectives and from all the. I think the entire industry was here today, so thank you for sharing. I'm happy for all the folks who said that this has helped, that e-cigarettes has helped them to stop smoking. I do have some critical questions, though, because I think that this is a serious issue and is impacting young people in a serious way. And I really like the nexus that the author of this bill is making between potential harm for children as it relates to e-cigarettes. And so I'm going to ask some questions, particularly to the opposition, about things that I have read and heard that seem factual and I think we should discuss. First one is, isn't it a fact that e-cigarettes contain nicotine? And if that is true, shouldn't we be passing this bill and doing everything that we can to keep nicotine out of children's hands?
We should be doing things to keep nicotine out of children's hands. That can be done without defining these products as tobacco. And also, unlike the FDA has stated that if a product, a component, or a part of a vapor product does not contain nicotine, they will not be regulating it as a tobacco product. That's in their deeming regulation that came out last April. But this bill would make even non-nicotine products, devices, just batteries that people sell, they would become tobacco products, but under the FDA's rules, they would not be. So I just want to make that
it's a good argument, but my guess is that no one's going to buy the vaping device without buying what goes with it.
That's incorrect.
Why? Why would somebody?
My colleague here could tell you better than me, but there are many vapors who step down off of nicotine. There are people who want to quit and they want to get off nicotine immediately. My colleague would like to add something.
Happy to hear it.
Thank you. So as a business owner with a retail vape shop, approximately 10 to 15% of all the e-liquid that we sell contains no nicotine, and we've seen a dramatic trend in the 2 years that we've been in business to where people have made a shift lower in nicotine, and now they like to having a huge component of how electronic cigarettes help people quit is because it mimics the hand-to-mouth motion, the habit of it. Mm-hmm. And so even when people have weaned themselves down, they still like to continue participating in the habit. However, they are celebrating not using non-nicotine products. So it doesn't make sense at all to me to classify a non-nicotine product as a tobacco product under this bill.
Let's continue with that line of thinking, that's very helpful to know. But as I've been reading some studies about when young people use e-cigarettes, many have said that they've never tried traditional cigarettes before. And so in the case of young people, they wouldn't be buying the vaping devices to step down if they have never smoked a cigarette before.
What we're finding is that, yes, there are large swaths of youth that have tried vapor products that have never smoked. But when you actually start to boil it down, look at past 30-day usage, and then go further, the 2015 California Healthy Youth Survey, as well as other surveys that are being done across this country now, are actually looking at times of the month, days of the month, that someone has used the vapor product. And when you get down to where there's actual habitual use, over 10 days a month, 95% plus, 90% plus, 98% plus in some states are either smokers or ex-smokers. So there is a vast difference in the literature about nicotine gum, patch, lozenge, other smoke-free nicotine products, where they've given them to people with Alzheimer's, with people with other diseases that may have some benefit to nicotine. They don't develop a dependence. There's a vast difference between inhaling burning smoke, literally freebasing nicotine, and a vapor product or any other smoke-free nicotine product.
And if I may, the studies actually don't differentiate whether these children are using products that contain nicotine or no nicotine. So theoretically, every single teenager who's been in this study has vaped a product with no nicotine. So the study isn't well-rounded or accurate because it doesn't even differentiate whether nicotine is used by the youth.
Different question, but I'm going to follow on the train that you were just going about.
Please.
Can we talk about lung capacity?
Absolutely.
I just read, just now, as we were having this conversation, a study that says 10 minutes of smoking e-cigarettes causes noticeable change in airway resistance in the lungs. And so, again, I'm going to always come at you from the standpoint of I think this is good for young people. And if we know that when things are exposed to young people that could put them in further harm's way down the line, I would say, as in this case, why not pass this legislation if we know that vaping creates resistance, airway resistance in the lungs, particularly for young people? I'm putting the lens of young people on it.
Sir, with all due respect, Dr. Michael Siegel, who's a professor at the Boston University School of Public Health, one of the original anti-smoking advocates who's testified against the tobacco industry, never taken a dime from them, he commented on that very study that I believe you are referencing and referenced another study finding that when people sit in a sauna for 10 minutes, that causes about the same level of airway resistance. That does not indicate any kind of harm. Short-term irritation does not indicate any kind of harm. And there's a great paper that I really encourage you to read, regardless of how you vote today. Lung Harm Reversal Polosa, P-O-L-O-S-A, an Italian researcher collected the evidence on studies that have followed vapors throughout months or years to look at their lung capacity, to survey them about their lung capacity. And you have smokers, people who smoked for 40 years, some of these people here today probably used to have an oxygen machine or used to walk with a cane. But because they get the same effect of quitting smoking, the lung capacity returning, even though they are vaping. That is what is happening in the real world, not in a clinical study that just looks at what happens after 10 minutes.
Thank you, sir. Did you have further questions? Two more. Okay, we're going to go. Assemblymember Thurman has his questions that he's wrapping up, and then Ms. Baker had one but doesn't. And we can entertain a motion now.
I'd like to move the bill.
We have a motion. We have a second. Thank you. Mr. Thurman, continue.
Thank you.
And then we'll move on.
I didn't read that study, but I'm happy to read it. When you meet me at the sauna, we'll read it together. How about that? The last one really is about the flavors of vapor. And I have a hard time accepting that these are not products being catered to young people when there are flavors such as gummy bear or other flavors that appear to be geared towards young people. And it just seems to me that if we want to protect young people, we would do everything in our power to do so, including say that we pass this bill so that young people aren't getting access to these products.
Well, I would just add, before going into flavors, you can get the same effect as this bill, the sting operations, retail licensing, without defining them as tobacco products. On flavors, 5 years ago, August 10th, 2010, I quit smoking with a watermelon-flavored vapor product. And since then, everything that I've used has been a flavor that opponents will describe as child-friendly or intentionally marketed to attract children. Today, I have mango. If you ask this room, if you are using something other than tobacco or menthol, are you using gummy bear or a gum or anything of that sort that they want to falsely paint, which has been something going on for 6 years? We have a great study, a survey of 4,500 adult vapors, finding that 70% plus their main flavor was either fruit or something sweet, and that they rated flavor availability, as extremely important in staying smoke-free. And so flavors are incredibly important, and I would urge you to talk to some of the vapors in your community, the people that have quit smoking, and ask them what they're using, and I think many of you would be surprised.
We don't agree, but I appreciate your discussion of the facts
Thank
today.
you, sir.
Thank you.
Thank you. We have a motion. We have a second. Assemblymember Cooper, would you like to close, please, sir?
Please. First of all, I want to thank all our speakers for coming out here today. I truly appreciate it, and it is a cessation device. The folks that have got off tobacco products, I applaud you. It's tough. Nicotine is addictive. It's hard to get off of. So I think it's a good thing you're off of this. This is really about our children. And the speaker to my left said it. Large swaths of youth try e-cigarettes. And that's the bottom line. And you can say tobacco, whatever, it's still the product in tobacco is nicotine. That is very addictive. We want to make sure our kids have a chance to grow up and not experience this. It is an issue right now. You go out in the streets, you see a lot of e-cigarettes, a lot of kids smoking e-cigarettes. A lot of your operations for alcohol and cigarette buying, underage decoy operations, they involve cigarettes for a reason, because kids are buying cigarettes. That's why we're doing those programs, because they do consume it. And this makes it more appealing, more attractive to these kids. And young kids, especially teenagers, are easily influenced. And some of these names do influence them. And the bottom line, this bill, you can still buy e-cigarettes. It doesn't change that. You can still sell e-cigarettes. You can still smoke e-cigarettes. Well, what does it change? The definition, the legislation, nothing else. So the rules today remain the same except for the legislation. So I really don't know what the big deal is. We're trying to protect our kids. That's the bottom line. So I respectfully ask for your support for this bill. Thank you.
Thank you, Mr. Cooper. We have a motion of due pass as amended to finance. It's been seconded. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine? Mainshine, aye. Baker? Aye. Baker, aye. Bonilla? Campos? Eduardo Garcia? Eduardo Garcia, aye. Levine? Levine, aye. Mays? Santiago? Santiago, aye. Steinnorth? Steinnorth, no. Stone? Thurmond? Thurmond, aye. Wood? Wood, aye.
The bill passes with a vote of 8-1. Thank you, Mr. Cooper. Next, we'll call up, I see Assemblymember Bloom, agenda item number 5, ABX2-6, local taxes, authorization, cigarettes, and tobacco products. Welcome, Assemblymember Bloom. Whenever you're ready.
Mr. Chair and members, I'll speak slowly while advocates come up, but I am here to present ABX2-6, a bill that allows counties to place local tobacco tax measures on the ballot for a public vote. The tax would only go into effect if a two-thirds majority of the voters approved, of course. Smoking continues to be the leading cause of preventable death in the United States, and at least 30% of cancer deaths and 87% of all lung cancer deaths are caused by smoking. Nationally, 1 out of every 5 deaths is attributable to smoking, and in California, 40,000 people lose their lives to tobacco-related illness each year, and tens of thousands of Californians struggle every day because of tobacco-related illness. Treatment for these ailments is often expensive. Medi-Cal spends almost $3.5 billion paying for tobacco-related illness.